Good afternoon and thanks for joining us for KOLD News 13 Live at 5. I'm Dan Maris.
And I'm Heather Rowe.
Why would you want to do that to people that need help and need to see doctors? Why?
Residents in southern Arizona don't know what they're going to do next now that they are losing their state funding for health care through Access. New at 5 tonight, the challenge facing southern Arizona's smaller communities now that they are losing state funding for health care for their low-income residents. KOLD News 13's Mark Stein reports from Bisbee.
Well, the Copper Queen Community Hospital, along with other hospitals here in rural Arizona, are not only facing cuts, but we're told could be facing closures if all of the cuts being discussed go into effect. That possibility has patients scared.
It's not like I'm a bum or anything. I work 6 days a week. I do my best to try. I don't understand why they would take it at all. No, I don't.
For the last 10 years, Laura Painter's battled cancer, congestive heart failure, and now she needs a pacemaker and is counted on Access for it all.
Without it, I would have gave up already. I wouldn't keep trying to go through all this to try to get better, because if I didn't have it, I wouldn't be able to get better.
Like Painter, 30% of the patients treated at this hospital in Bisbee are covered by state health care.
I worry for the people we care for.
Jim Dickson's the CEO of the Copper Queen Community Hospital. He says cuts to Access are especially hard in rural areas in southern Arizona because they have higher unemployment rates and people who are hurting for money have problems with insurance.
This hits the rural hospitals a lot harder. Our margins aren't there like the larger hospitals, so when we get these kind of cuts, they're literally devastating.
Dickson says the proposed cuts would cost his hospital nearly $1 million and other hospitals in Cochise County even more.
So you're going to take an already strained and stressed system and cut it back even further.
The Arizona Hospital and Healthcare Association has proposed a plan that Dickson says would save the state from cutting access further, a plan that's already being used by 42 other states.
And it's a form of assessment that's not passed on to the patients, where we assess ourselves and send the money to the federal government and they double it up and send it back. And it will ameliorate the need for these cuts.
As for Laura Painter, she not only hopes but prays for anything that will keep her covered.
Why would you want to do that to people that need help and need to see doctors? Why?
Now, we are being told that Governor Jan Brewer has received the Arizona Hospital and Healthcare Association proposal, so now it remains to be seen just how deep these cuts could go. Reporting in Bisbee, I'm Mark Stein for KOLD News 13, live local, late breaking.
Arizonans without children make up those 250,000 Access patients losing coverage. And now Governor Jan Brewer is proposing some changes that she says will allow Arizona to drop fewer people down the line. Brewer's new plan includes asking Access patients to make co-payments, charge them if they use a taxi to get to their medical appointments, and charge them if they don't make it to their appointment.